as the nation shifts toward slowly reviving the economy, with several states allowing a gradual reopening of businesses and others indicating they will soon do the same. Governors from across the country are set to appear on television on Sunday to articulate the latest steps in their response to the coronavirus pandemic. For weeks, the Sunday morning talk shows have emerged as a critical, highly visible platform for governors to detail the urgent needs of their state and, at times, challenge President Trump in demanding a more robust federal response. This week, the governors of Oklahoma and Colorado will be among those discussing the steps they have taken toward reopening their economies. Oklahoma's Republican governor, Kevin Stitt, who allowed businesses including hair and nail salons, barber shops, spas, and pet groomers to reopen on Friday, is to appear on Fox News Sunday. Governor Jared Polis, the Colorado Democrat who has indicated he will allow limited reopenings beginning May 1, is to appear on State of the Union on CNN. Stacey Abrams, who opposed Brian Kemp in the Georgia governor's race in 2018, will appear on State of the Union and meet the press on NBC. Mr. Kemp, a Republican, received a wide range of criticism from Mr. Trump, as well as from Atlanta's mayor, Keisha Lance Bottoms, for his plan that permitted salons, tattoo shops, and bowling alleys to open on Friday, and will allow dine-in restaurant service and movie theaters to open on Monday. Hardy Davis Jr., the mayor of Augusta, Gage, who is a critic of Mr. Kemp's plan, is scheduled to be on CNN's Inside Politics. Larry Hogan, Maryland's Republican governor, and Gretchen Whitmer, Michigan's Democratic governor, both fixtures on the talk show circuit in recent weeks, will return on Sunday. Mr. Hogan will appear on CBS's Face the Nation, as well as on ABC's This Week, alongside Ms. Whitmer. House Speaker Nancy Pelosi is set to be on State of the Union. Treasury Secretary Stephen Mnuchin is scheduled to appear on Fox News Sunday. And Dr. Deborah Birx, the White House Coronavirus Response Coordinator, is to be on State of the Union and meet the press. In New York, Governor Andrew M. Cuomo on Saturday announced new steps to ramp up testing, offering eligibility to more residents and allowing any pharmacy in the state to conduct tests. Mr. Cuomo, who has emphasized that testing capacity needed to increase sharply before he would consider reopening the state's economy more widely, said that emergency workers, healthcare workers, and essential employees could be tested even if they are not showing symptoms. He also announced an executive order allowing any of the state's roughly 5,000 pharmacies to administer tests. That's been a big complaint across the board, Mr. Cuomo said. Everybody wanted tests and they couldn't get tests. The state was beginning to conduct antibody tests on frontline healthcare workers at 4 hospitals in New York City, the governor said, and would expand that testing to emergency workers and transit workers next week. A detailed county map shows the extent of the coronavirus outbreak, with tables of the number of cases by county. On the first day in weeks that the White House did not hold a briefing on the coronavirus, President Trump lashed out at the news media for asking hostile questions and suggested his daily appearances were no longer worth his time. What is the purpose of having White House news conferences when the lamestream media asks nothing but hostile questions, and then refuses to report the truth or facts accurately, Mr. Trump wrote on Twitter late Saturday. They get record ratings, and the American people get nothing but fake news. Not worth the time and effort. The tweet came 2 days after Mr. Trump suggested at a briefing that an injection inside the human body with a disinfectant could help combat the coronavirus. Despite a lack of scientific evidence, Mr. Trump has long pushed various ideas against the virus, like sunlight and warmer temperatures, as well as an array of drugs, including the malaria drug hydroxychloroquine, which he has promoted as a "what have you got to lose" remedy. Medical experts have since stepped up warnings about the drug's possibly dangerous side effects. Since Thursday's assertion, Mr. Trump has been angrily tweeting about the unfairness of his coverage after a damaging news cycle his aides have privately admitted is self-inflicted. Officials have also said that they were skeptical that Mr. Trump would fully retreat from a scenario in which he took questions from reporters, even though he said the 2-hour format of the briefings was not worth the effort. Officials inside the White House are also discussing replacing Alex M. Azar II, the Health and Human Services Secretary, after a string of news reports about the administration's slow response to the coronavirus and a separate controversy about an ousted department official, 2 senior administration officials said. Mark Meadows, President Trump's new chief of staff, is among the aides considering removing Mr. Azar once the height of the coronavirus crisis abates, the officials said. The discussions were first reported by Politico and the Wall Street Journal. On Saturday, 2 senior administration officials said that no imminent changes were planned. Among the possible replacements are Seema Verma, the administrator of the Centers for Medicare and Medicaid Services, and Dr. Deborah Birx, a key member of the coronavirus task force. Mr. Trump has become angry with Mr. Azar in recent weeks, after stories in the Washington Post and the New York Times detailed decisions and discussions related to the administration's response to the coronavirus. Mr. Trump, who has closely followed the coverage, was upset that he was being blamed while Mr. Azar was portrayed in a more favorable light, aides said, adding that the president was also suspicious that Mr. Azar was trying to save his own reputation at the president's expense. Other officials were angry that, after Mr. Azar and other top department officials forced out Dr. Rick Bright, the head of a key drug and vaccine development agency, Mr. Azar told Vice President Mike Pence in front of a crowded task force meeting that Dr. Bright had been promoted. But on Saturday, the White House issued a full-throated defense of Mr. Azar, calling the rumors false. The Department of Health and Human Services, under the leadership of Secretary Azar, continues to lead on a number of the president's priorities, Judd Deere, a White House spokesman, said in a statement. Any speculation about personnel is irresponsible and a distraction from our whole-of-government response to COVID-19. A walk in the park brings tense flare UPS, back off, you're too close. Oh really? Then stay home. A loud neighbor, once a fleeting annoyance of urban life, is cause for complaint to the city. Wake at noon, still tired. The city's can-do resilience has given way to resignation and random tears. The journey that began in March with an us against it unity, with homemade masks and do-it-yourself haircuts and Zoom happy hours, has turned into a grim slug for many. It felt as if the city had cautiously approached a promising bend in the road, a new page on the calendar, only to find nothing, and beyond that, ever more of the same. A feeling of sadness shot through with frayed nerves could be felt in conversations in and around New York City as the coronavirus outbreak in the world's epicenter dragged toward its 6th week, its end still too far off to see. This is the week where I feel like I have accepted this, and given up, Unichi of Brooklyn wrote in an email. My daily commute to the couch feels normal. Separated from Boston by the Mystic River, Chelsea, Massachusetts, is a world apart, a first stop for immigrant families Lithuanian, Polish, Irish and more recently, Honduran and Guatemalan who cannot afford the bigger city's sky-high rents. It has a population density of nearly 17,000 people per square mile, with whole families crowding into single rooms in triple-decker row houses, buildings with high rates of lead paint, asbestos and air pollution. It is also the center of the coronavirus crisis in Massachusetts, with rates of infection that surged last week to 3,841 per 100,000 people, around 6 times the statewide average. This spring, the virus collided disastrously with the city's overcrowded housing. A warning flare came in the 2nd week of April, when, late at night, a young mother called the city housing authority from the street. She had disclosed her test results to her roommates, and they had kicked her out. It dawned on me that this situation was going to replicate itself, said Thomas Ambrosino, Chelsea's city manager, and we better have a solution. For Paul Nowicki, the director of operations for the housing authority in the city, one difficulty has been safeguarding residents in a building when he cannot locate infected people. Many leaders will face the same stubborn challenge: how, in a country that values its citizens' medical privacy and autonomy, can authorities separate the sick from the well? The question is an urgent one if public life is to resume. A wide stretch of West Virginia and Ohio is fighting the coronavirus pandemic with 530 fewer hospital beds than it had last year, after a for-profit company shut down 3 of the area's larger hospitals. Beginning in 2014, Alecto Healthcare Services acquired the 3 hospitals, Fairmont Medical Center in Fairmont, West Virginia, Ohio Valley Medical Center in Wheeling, West Virginia, and East Ohio Regional Hospital in neighboring Martins Ferry, Ohio. Employees expected the new ownership to put the institutions on solid footing after years of financial struggle. Instead, decisions made by Alecto wound up undercutting patient care and undermining the hospital's finances, according to more than 24 interviews with doctors, nurses, other staff members, government officials, and patients, as well as a review of court records. In large swaths of the U.S., people have a hard time reaching a hospital that offers the kind of inpatient care needed to treat the coronavirus. Doctors were fired to save on salaries, many patients followed them elsewhere. Medical supplies ran short. Vendors went unpaid. Finally, one after another, the 3 hospitals ceased operating. The counties they serve have already recorded 171 coronavirus cases and 9 deaths. Hundreds of people whose lungs were scarred by decades in coal mines are vulnerable to a devastating respiratory syndrome caused by the virus, doctors said. We've now got a hospital that existed for over 100 years that, in the middle of a pandemic, sits empty, said Jonathan Board, chairman of the Marion County Chamber of Commerce's Board of Directors, referring to Fairmont. Dr. John Wolin, the former trauma chief at Ohio Valley, now works at Wheeling Hospital and is bracing for an influx of patients. The extra capacity that we will absolutely need is not going to be there, he said. Students are demanding tuition refunds in a wave of lawsuits against universities, which have largely turned to online learning because of social distancing measures during the coronavirus pandemic. On Friday, lawsuits were filed against Columbia University and Pace University in New York, arguing that the quality and value of the education has been compromised. Similar complaints had been filed against Drexel University, the University of Miami, and the University of Colorado. Colleges have been reluctant to refund tuition, a major source of operating revenue. They say students are still getting the classes and degrees they signed up for, just in a different format. The new lawsuits charge the universities with breach of contract and unjust enrichment, saying they promised a campus experience rich with amenities like gyms and libraries and the arts but have stopped delivering on those promises since mid-March, when most students were asked to evacuate their dormitories and shift to online classes. If the students wanted to go to Columbia and earn their degree online, they could have done that, but they chose to go to the on-campus version of Columbia, which is heavily marketed for its experiential and educational value, said Roy T. Willie IV, a lawyer for the plaintiffs. In court documents, the plaintiffs argue that the universities have admitted that online and in-person classes are not equivalent through their pricing and marketing. Tuition for an online social work degree at Columbia, for instance, is almost $10,000 less than for the same degree earned on campus, according to the documents. Columbia did not return a request for comment. A spokesman at Pace, Jerry McKinstry, said the university had done its best to accommodate students by shifting mental health counseling online, allowing most classes to be taken pass-fail and adjusting housing fees under circumstances beyond the university's control. Since transitioning to remote learning, as mandated by the state of New York, academic programs and services have continued, Mr. McKinstry said. The coronavirus pandemic has left many in need, but there are many ways you can assist, and often no money is needed. China's new export rules for some medical supplies will put more of the burden for quality checks on importers. Reporting was contributed by Sarah Cliff, Joel Pedersen, Rick Rojas, Ellen Barry, and Michael Wilson.